Hey everybody, CJ Maurer here, back again with Melissa Wilson. Melissa is the VP of Customer Engagement for EZaccessMD. They are a telehealth company based in Rochester, New York, and we've actually connected before on a similar format, so this is kind of fun. But I really wanted to get Melissa on, not just because she's a really smart and nice person who I enjoy speaking with, but also because telehealth and telemedicine is a really big deal right now. And so I think there's a lot of interesting things to talk about. And I'm very curious to hear how her organization's doing and what she thinks might play out in terms of, larger societal shifts in terms of how we seek health services and medicine. But we'll get into that. First of all, Melissa, how are you?
That's a loaded question. I feel like I'm doing my best, which is what I think we can expect. That's all we should expect from everyone right now during this time. We've all seen a huge shift in our lives, both personal and professional. And so I think I'm doing well. But I'm glad to be back here with you, even though we're not together in the same place. You are also a nice person to speak to, so happy to be here.
Thank you. I appreciate that. We were talking just before we started recording, we were talking about our kids and how we both have two kids, a boy and a girl, and how, mine aren't school age yet, but yours are. And describe to me, I know you just said really quickly it was hard, but describe to me what that's like, having to administer a curriculum in addition to being a parent and working.
Yeah, I think there's different challenges, right, that come with different ages. So it's easy to say that because yours are younger than mine and not, part of this distant learning environment that we now find ourselves in, some people are saying, well, I've got teenagers and, I don't have to do the one-on-one learning, but every single age group comes with its own unique challenges. I think that, having a kindergartner and having a second grader, it's been trying at times, and we're just trying to make the best of it and keep smiles on all our faces at the end of the day and do our best and have fun. But also at these ages comes some level of awareness, which for younger ones maybe isn't quite there yet. So we've had to answer a lot of tough questions about what's going on, challenges that people are facing, why we can't see our cousins and aunts and uncles, and why we can't, go the places that we enjoy going as a family. And if we do, it looks very different. Masks, quite frankly, freaked my kids out. So it's been an interesting time. It's surreal. And on the EZ side, I think telemedicine has been thrust into the forefront of this pandemic because, it's ultimately the safest way for people to seek the care that they need. People are still getting the flu and still getting sinus infections and still dealing with, right now, poison ivy and all of the different things that come with spring to summer season changes, and just, those normal common things that are still happening that are not maybe coronavirus, but many of the symptoms are similar, and people need to know that they can be supported. And, not only our business, but businesses that are used to doing things a different way have had to look at their business model and decide how they can help their community during this time. So it's been really interesting, just as a person with a passion for marketing, to see how some of these businesses have really stepped up, especially in our community here in upstate New York, and changed at the drop of a hat what they were doing, and now they're doing something different to help the community in a time of crisis. So that's been an interesting thing to see happen all around us, and I'm sure that you can think of some examples of that, and so can I. And many of our clients, Ledestri being one of them, that just started manufacturing hand sanitizer because that was the need. So it's been amazing to watch from that perspective. I'm always trying to look at the positives.
Who's Ledestri? That name sounds familiar, but I don't know the company.
Ledestri Food and Drink. So they do a lot of tomato sauce. They do big manufactured goods. They've got a large facility in Fairport, and they also have employees across, Pennsylvania and New Jersey. They're rather large, but mostly manufacturing. Sorry?
And now they're making hand sanitizer.
Right. Yeah. From tomato sauce to hand sanitizer. And they've done a ton in the community. You know, I've been kind of watching it closely. But, you know, donations of things to Food Link and all of the things that not only them, but organizations in our community are doing. Another one of our clients is Trillium Health. And, you know, they were right out at the front of this. They had set up triage tents in their parking lot and very sophisticated testing for people that, you know, wanted to get tested and didn't have insurance or didn't have the means, and making those tests available to people that may not have otherwise had access to them. And I think it's really fascinating to see. I think Rochester's lucky in that we've got a lot of really great businesses here that have, you know, the people in our community at mind when they're making their decisions.
Yeah, you're definitely seeing that in Buffalo, and you're hitting on something that makes me really feel like there's kind of two overarching feelings I have about this whole thing. The one is, like, there are people who have lost their job and their livelihood, and
Yeah, absolutely.
that's really, really unfortunate. And it's nice for them to see other people in the community responding. It's nice for them to see that the government, to some extent, is trying to help them out during this time. But, you know, those people are really tough, and I really feel for them. And you know, I wish there were more things that we could do, and maybe there are, we just haven't figured out. So, like, I'm just really mindful of them, because the stark contrast is really how fortunate I have been. And I do think it is a privilege. I will call it a privilege to have chosen a line of work, or have made my way into a line of work that isn't largely disrupted by this, and that I can continue moving forward without being deeply concerned with how I'm going to provide for my family, our overall health, safety, and well-being. And that's really good. So if you can, like, kind of put aside, like, the unfortunate damage for a minute, which I don't want to ignore, which is why I brought it up, it is impossible not to also see all of the really good that's come out of all of this, just in terms of just people pivoting, innovating, really showing compassion and care for other people. I just think that's really tremendous. And I think there are certain things about this that people will always look back on very fondly. And I hope some of these things will carry with us when this whole pandemic subsides. If it does, I'm not, you know, I don't really know. I'm not going to pretend to know, but yeah, I think I'm really glad that you pointed that out, because I think it's important to focus on the positives as much as possible, not at the expense of ignoring, like, the great collateral damage that is happening, and you know, hoping that these people can find a footing, or either, you know, get their you know, way of making a living back, or have it, you know, subsidized in some way, or do something in the meantime. So I really hope that can sort itself out. But yeah, overall, I mean, there is a lot of good. There's a lot of, I mean, just talk about kids, right? Like, my kids are probably loving this, because they're 4 and 2, so they don't hate us yet as parents. So they love spending time with us. They love it when we play with them, and we build Legos, and we go on walks, and we watch movies, and, like, whatever. And so they're getting more time with mom and dad, and that's awesome. And that's something that I know I'm really treasuring.
Yeah, and there's a balance, right? And people are going to look back on this and have mixed emotions. But I think at the end of the day, you know, this common mantra that I keep hearing, you know, we're all in this together, is, you know, finding ways to help people that, you know, are less fortunate or are, you know, restricted in some way. And for EZ during this time, you know, the fact that we come to you, our technologists, go to our members' homes, means that they don't have to find a way to seek care. You know, some of our members don't have transportation. They don't have a means to get to seek healthcare at all. And they're taking, you know, buses or public transportation to try and do things in a somewhat normal way. Well, everything's been disrupted, is just difficult. And sometimes not even an option, because I know personally, I have heard from many of our members that have tried to get into their PCP or go to an urgent care for something, and they won't see them, or there's significant delays in how soon they can get in to see someone. And so the fact that we're 24/7, we're going out to the home, you know, we're still there for our members who need us during this time, Of course, we're doing a coronavirus screening, and if you're at high risk, our doctors can provide support. You wouldn't be eligible for a mobile visit, but for anyone else, you know, that's just got these common things that we deal with every day, that maybe now we have less of an option of where to go to get them, you know, cured or treated. We're still in homes every single day, you know, and then you don't have to worry about being in a germy office and wondering, you know, what am I picking up? What risk am I taking by putting myself or my family member in this environment during this time? You know, you don't have to have those concerns. Our techs come out, they're fully geared with PPE head to toe so that you're safe, they're safe, and then the community is safe. Here in Rochester, actually, our sort of parent company, if you will, has partnered on some level with Rochester Regional to help support them in keeping people out of the hospitals, you know, that don't really need to be there. Because if you don't need to be in a hospital right now, you shouldn't be. That's just an unnecessary risk, really. So it's these types of things that I think I keep trying to look at as the silver linings to come out of all of this. People are generally becoming more comfortable with telemedicine in general, with talking to a doctor remotely, with the technology that they need to be able to be comfortable with to use it for it to be effective for them, effective means of, you know, accessing healthcare. And so there's been a lot of changes. You know, I've been kind of excited to see it because basically we're on the front lines since the
Describe
beginning.
a little bit more. For those people that don't know, like what is EZaccessMD? What do you guys do? I mean, I think people,
Sure.
anybody who's watching or listening is starting to figure it out. But yeah, what this for me?
Sure. I don't know about you in Buffalo, but just went from sunny skies here to torrential pouring rain, gray, cloudy skies, and thunder and lightning. If it's anything about our day, our average day, and how unpredictable it can be, is the weather here in upstate New York.
If you don't like the weather, just wait a day. Yeah, it like downpoured about 2 hours ago here for a little bit. And now it's just like drizzling and dreary.
Yeah, no, looks like it's come our way. But sure, yeah.
Vegetable garden though.
Yeah, we have started one. Have you?
Yeah, this year.
Oh,
I've wanted
great.
to do it for years. I've probably talked about this on every single episode that I've done.
Reoccurring theme.
Just because I'm excited about it. Yeah, I just realized that if I never did it now, then I mean, I would just never do it, and I'd just be a chump who runs his mouth. So I finally built a nice raised bed, and I'm having so much fun with it. But yeah, so EZaccessMD, what is it?
Nice. So I like to call us a tech startup. I don't know, we were founded in 2016. So can you still call us a startup? I'm not really sure, but I just love the mentality of startup where it's just like fast paced. Everyone is wearing multiple hats, getting things done. Things move quickly. Growth happens quickly, and I just love the roller coaster ride. So I guess even maybe when we're 10 years old, I'll still be calling us a startup. But we're essentially the only mobile urgent care provider in Western New York. Not only that, we are operating out of 6 different states across the US, and we provide service to roughly 25,000 members who have access to low acuity healthcare at no cost that comes directly to them. So what that looks like is different for our members based on the level of eligibility. So for example, if they're in an area that is mobile eligible, then they have techs that can come to the home or the workplace and run diagnostic testing, medical imaging. We can do roughly 85% of what can be done in an urgent care setting just with the technology in our kit, and then the portable X-ray and ultrasound technology that we have as well. And then some of our members are just phone-only traditional telemedicine users. So we've got several clients that have employees across multiple states, and sometimes they have somewhat of a blended program where some of their employees are eligible for full service and some are eligible for just phone-only service until we're up and running in their area. But yeah, it's giving people the experience with healthcare that they have come to expect with just about everything else. You know, it's this consumer-driven lifestyle of, I want it now, it needs to be convenient, it needs to be free, it needs to be dropped off at my doorstep, because that's the only way that fits my lifestyle.
Well, when you think about it, we've like DoorDashed pretty much every other aspect of the things that we buy or consume. You know what I mean? Or if
Right.
not, we're like in the process of doing that, right? Basically, service on demand, service delivered, a la carte, self-serve, self-order. You know, the friction has been reduced in order for us to access so many of the goods and services that we want or need and rely on. And the question would be like, well, why not healthcare? Well, the reality is
Right.
that it's been that way for a while. I mean, I know some physicians who have been beating the drum on telemedicine. You know, physicians who have been running large specialty practices here in Buffalo who have been banging the drum on telemedicine for the better part of this last decade, just because they believe in it. They believe in how it can provide more access to people, make it more efficient for not just the patient, but also the doctors. A lot of
Right.
times a quick consult, you know, you don't need to drive wherever you need to drive, right? When you think about too, if you don't live in a major urban center, in order to see the specialist you may need to drive an hour, hour and a half, and maybe then you sit there and you wait in line for who knows how long, and then, you know, where it's really just a consult, and you need that time with the doctor. But how can you know what I mean, make that doctor and that medical experience or expertise rather more accessible? I have a friend who lives out in Portland, Oregon, and when this whole thing went down, she thought that, I don't know, I think she thought she had strep or something. I don't remember exactly, right? But she was telling me the story about how like she like held up her computer and like allowed her physician to look into her throat.
Mm-hmm.
And she said she was laughing because it felt weird at first, but it was extremely productive. She got whatever like antibiotics or medicine she needed, and she was on it was like just as effective as if she would have seen that doctor in person. And
Right.
you know, just that one snapshot that made me think of you. I didn't reach out because this was like probably 2 months ago I had this conversation with her, but that made me think of you and what you guys are doing. And I wonder if you think like, you know, telemedicine obviously has existed. Most people have a frame of reference for what it is, although we haven't totally adopted it yet. Do you think this is going to be a major catalyst for, you know, Americans at large adopting
Absolutely.
telemedicine?
Absolutely. Whether they're forced into it or not. But as you say, there have been physicians that have, they were early adopters, right? They've embraced this and they've tried to push it out there so that more people can take advantage of the benefits of telemedicine. But it was never really something that the masses became comfortable with. And there's, you know, been some barriers in place, and, you know, we've kind of figured out what are these barriers to people using telemedicine? Why aren't they using it? And it's helped us in our business model to remove all those barriers, which has contributed to very high utilization rates of our benefit. And, you know, we're telemedicine to the next level, because whereas your friend, you know, held up her computer, and that's going to give you an okay image of the throat. But if the tech can come to your home and use a throat camera or camera enabled otoscope to get really clear, close HD images and transmit them to the physician 300 miles away for them to read and review, then you're going to have a better accuracy, you're going to have a safer diagnosis, and, you know, better results for the patient, better patient experience as well. So it's all of the things that are great about telemedicine that are finally now people are sort of needing to embrace, not having another choice really. But I think that once I don't want to say come out of this, because I don't think we'll ever truly go back to any type of life that was as we were before COVID.
Right.
I think it'll always look different, but people will be, you know, evaluating their experiences with telemedicine and expecting more, because that's what happens when something gets, you know, pushed on us and we have this experience that we develop this perception of it. And then you want to evaluate, you know, well, how can this be better? How can this be different? How can we do better for members? So I think that, you know, it's the perfect opportunity for EZ to shine and help more members in our community, really. And then I anticipate that there's going to be probably more businesses doing what we do and elevating the level of, you know, concierge style healthcare services they're offering to their patients, which will be nice to see, because as a mom of 2 kids with a full-time job and a husband that has a full-time job, you know, sometimes it's nearly impossible to get my kids in person to, you know, a well visit, or, you know, if I already know they have an ear infection, I just need to go there so that the doctor can look in their ear to get the antibiotics that I already pretty much know that I need. You know, it's pretty disruptive on our lifestyle, and it's hard, and healthcare shouldn't be that difficult. It's already too expensive, and it's already too hard for the average person to get the care that they need. It shouldn't be this difficult. It shouldn't be such a pain. And that's what we're trying to do, is improve people's access to healthcare, make it more affordable and less of a pain, really.
And there's some efficacy around like your model to begin with. First of all, telemedicine, right? But also, I don't know if concierge is the term that you use for it, but like the fact that you'll come to them as well. I mean, there are home care agencies, right? Now, normally it's associated for senior population,
Seniors, right?
Right? But we don't normally think about that for the general population. But that seems incredibly attractive to me. And, you know, it makes me wonder, like, why I haven't done that. Like, I'm somebody who likes to embrace all of those things. But, you know, I'll give you a perfect example. I used to go to a, you know, family general practice, just a primary care physician. And it was a huge practice. I could never call and like talk to anybody. Like literally I would call, it'd be a busy signal, wait 10 minutes, busy signal, busy. Like literally I couldn't even get to the receptionist.
That's so annoying.
So like, yeah, so then I didn't make my next appointment, and then I blinked and it was like, you know, 2 or 3 years since I last saw a primary care physician. So I was like, you know what, I need to do this. So I researched like primary care physicians still accepting patients, and I found a new physician, and I saw her a couple months ago, and it was great, you know, but it makes me wonder, like, would I have preferred the first visit to be, you know, virtual, or have her come to me, or have, you know, a physician's assistant or an NP come to me? I don't know. Like, maybe it was good that I met her firsthand, but now moving forward, I'm thinking like, with the amount of time it takes to like find an opening and then travel and like that whole thing, it would be so much easier if, you know, on regular checkups, or if I was sick or something, just to have that option. And I think if it's forced upon us now, right, like it's one of those things where once you try, it's like, well, why don't we should be doing it this way.
Right. You want to have that convenience all the time. It's like, once you get a taste, you don't want to go back to doing things the way you did, because, you know, you've seen the convenience and you've seen the time it saved you, and you know, you've got the same result in most cases. So why go back to doing it any other way? You know,
I had a friend tell me he got the Apple AirPods, and I was thinking about buying them. And I said, hey, what do you think about those? You know, he goes, honestly, CJ, they're awesome. They're so awesome. This sounds so corny, but I can't believe I ever had wireless earbuds before. But I mean, I just use that as an example of almost anything.
Yeah.
Anytime we get used to a convenience, right? We never want to go back. Who wants to, if you have a dishwasher, who's going to wash dishes manually, right? It's silly stuff. And anyways, so.
Yeah. Once you have a Roomba, you're never vacuuming your floors again.
That's right. That's right. Like manually moving a vacuum just feels so 18th century to me.
Right.
No. Yeah, but no, that's a good point. I think it'll be really interesting to see, you know, how all of this proliferates. Where do you think it starts? Like, so for your particular organization, right? Like, you need employers to bring this on as a benefit, and then that's how, you know, the employees can offer it. Do you ever see, I don't know if EZaccessMD has this as a model, or if this will proliferate at some point, where just maybe somebody without a physician wants to get a physician and wants to either do it remotely or have somebody come to them. Like, is that an option now, or do you think that ever will be?
Perhaps. I think we've seen such a significant growth during this time, just in the last 3 months, of this global sort of health crisis that we find ourselves in. There's, you know, substantial signs that telehealth isn't going away. It's going to, this has forced us to accelerate the, mainstream take up or acceptance rather of telemedicine. So while we don't offer it to individuals and families, that just want to sign up for our service right now, I can see that very likely we will in the future. Right now, it's just an employer-based benefit, really. Something that they want to give their employees because they recognize all of the barriers to healthcare, the burden, the costs, and they want to keep their employees well. So many benefits, so many soft benefits as well that sometimes we even forget about, just the cultural impact of making this investment on behalf of your employees and giving them access to free healthcare. Our utilization rates in the first quarter of this year were 125%. That was across all of our clients. So, at a time of need when people are, quite frankly, scared and worried, and it's uncharted waters, and you don't, want to put yourself or your family in any elevated level of risk, this benefit, we get just so much feedback from our members that have used the service specifically in the last few months, that they really didn't know what they were going to do if they didn't have Easy. So I think that once businesses, we're already seeing it sort of in our southern states, but once businesses here in New York, where I feel like we're still kind of climbing that curve and maybe not on the other side of it yet, but that's just my own opinion. Once we get over the hump, if you will, then people are going to be evaluating their programs and looking at, what worked and what didn't, what did people like, what challenges were there with it, and, looking for better alternatives. And so we're going to continue to see significant growth. And I think once we get to a point, we will then be able to handle taking, individuals who want to sign up themselves or their families. But right now it's pretty much only employer paid. Employer makes the decision to bring it on for, either the whole group population of employees or some subset, maybe just those on, the health plan, for example, or just those that are full-time, maybe even just those that are part-time and don't have any health benefit. They can't offer it to them. They give them this. So it's really employer's choice. They can choose who to enroll, and we go from there. And there's different pricing models so that it works for all types of employers. Typically, our clients are in the range of 250 employees to 3,000 employees. That seems to be kind of our sweet spot. But then their family members are all enrolled at no additional cost.
That's unbelievable.
It's pretty cool.
It's really unbelievable.
Yeah, it's a really exciting time to be in this, I don't even want to say business because it feels like a mission in life sometimes, just to, make this healthcare system better for Americans in general. But it's just been really fulfilling because, again, like silver lining at this time can be really tough and depressing and, scary too. So all of the people that we're helping and all of the feedback that we get back, it really just, kind of fills my cup.
Well, I'm really excited to hear you say that because I've wondered the same thing. And quite honestly, I feel myself, I feel like I'm very fortunate I get a lot of fulfillment out of what I do. I help businesses, stabilize themselves and grow by engaging their customers. And I really, really help small to medium-sized businesses become a lot stronger and more true to their mission. And I do take a lot of fulfillment out of that. But I have to say, in terms of what you guys are doing, and especially this moment, the magnitude of what your work represents, it's envious. It truly is envious that like you guys are doing what you're doing, because it pales in comparison to what I'm doing. Quite frankly, even though I'm very happy with my business and my line of work and I'm very fulfilled with it, it is really cool. So I'm glad that you recognize that because it is really important. And I think other people understand that too. I mean, you also brought up how you're not really convinced that maybe we're on the downswing, and whether or not that's true, there's a lot of speculation that, and I'll leave it as speculation because that's as far as I'm credentialed to label it. There's a lot of speculation that even if there is a downswing, there's going to be another upswing in December or January or whenever when it gets cold, right? So keeping people out of the hospitals as much as possible really helps solve this national public health crisis. Not to mention, by the way, that I've heard a lot of people in the medical industry and the technology industry talk about hospital-borne diseases and infections being a problem before anybody knew what COVID-19 was, right? There are a lot of businesses that exist to create products for cleanliness and sanitation and air purification and all of these things to limit hospital-borne infections, even in quote unquote normal times, right? So the fact that now we have a pandemic that is only elevating that, right? Keeping people out of hospitals, not only that, because also it's more expensive, right? Keeping people out of hospitals is in the best interest of everybody, especially when they're overcrowded. And so I really commend you and your organization and the stuff that you guys are doing. It's really cool. And, you know, I'm definitely going to, you know, continue following along. It's been, I don't know, weird, but like reassuring to know that there are people out there like you guys, along with all the first responders, that are actually making a significant, substantial difference in what's going on.
Thanks. And you bring up a good point too. It's, you know, it's all about keeping people out of the hospitals, not only because of the cost, but because of the risk, but also because we're protecting our doctors and nurses that way. So the less people that we're sending in, you know, reduces the burden on them, really. And we're going to need them. They're our frontline, you know, first line of defense. And so when we can help support them by keeping people that don't need to be in the hospital out of hospitals, then that lets them do the critical work that they need to do and have the room and have the work resources and not be totally burnt out because, you know, they're there all day, every day because they can't catch a break and we're in a global pandemic. So it's, you know, it's been interesting to see how, you know, doctors and nurses and all medical professionals are all, you know, essential workers have come together to kind of, I don't think that bond will ever break now. It's just been so critical to see how we've set all sort of previous regulations or guidances aside and just, you know, banded together for people.
Yeah,
you know, as humans. It's been reassuring.
I'm glad you brought that up. Two of my brother-in-laws, two of my wife's brothers, have served in Iraq and Afghanistan. And one of them is still in the Army. The other one got out and went to PA school and is now a physician's assistant here in Buffalo at a major hospital. And this younger one, I remember like worrying about him when he was in Afghanistan, you know, doing all the things that he did there. And I kind of worry about him now in a similar way, maybe not quite as much, but you know, he tests people for COVID-19, like that's part of his job. And then he treats those patients. It's like, you know, and so it is you and my sister, she's a nurse at Dartmouth Hospital in New Hampshire. And like, I worry about them often because they're the ones who are doing the necessary work, right? So that we can all live normal lives, putting themselves at risk. And, you know, I always like when, you know, at sporting events or whatever, when they honor people in the military and things like that. But I've really, really enjoyed this. A part of this whole situation that I've enjoyed is watching, you know, medical professionals, teachers, and a whole bunch of other professionals really be elevated to that level of importance. Because quite frankly, everything they do is a lot more important than what I do. You know, and it allows me to, you know, run my marketing agency and talk to people like you on a recorded Zoom chat because this is fun.
Well, you're doing what you love, and not many people get to do that either. So that's something to be commended as well. But yeah, even now I just think about all the people working in the grocery stores, you know, the people that, you know, we are delivering our packages so we don't have to, you know, go into the stores. It's crazy to think of all of the people in this community that, you know, maybe have not been held to a certain standard before all of this. And now are, you know, we recognize their importance in this, you know, for this whole thing to work, because, you know, I don't know how I would have done it if I couldn't get things delivered to my house, if I didn't have my groceries delivered to my house, if I didn't, you know, have the certain essential things that we needed there for us, thanks to other people.
I mean, we just talked about how we have vegetable gardens, right? So we're taking a little bit of that into our own hands.
Small part.
I don't know how to grow like chicken or like the little yogurt pouches my kids like. So, definitely. That's all really important.
Yeah, my neighbor texted me this morning that she's getting chickens. And we live in, suburban Penfield. No
Right.
one in our neighborhood has a chicken coop, but she's decided this morning she's getting chickens.
That's cool.
So
My
everyone's
in-laws
kind of
have them.
taking, yeah,
Yeah, they do. They've had them for, I think this is the second summer. So
it's fun. I mean, you realize, and especially if you have kids and the kids get involved, it's just, changing the way that we live.
yeah. Well, listen, Melissa, I have to say, as always, I really enjoyed talking to you. I really appreciate, taking the time and providing some insight, not only into Easy, but also to the, speculating about telemedicine as a whole. I think it's really important, and I'm glad that you and yours are out there doing what you're doing.
Thanks, CJ. It was so nice being on to talk to you, and just anybody that is out there listening, stay safe, stay sanitized, stay 6 feet away, do
Perfect.
all the things.
I'll make sure I include a link to your website as well when I publish this. So anybody who's
Great.
watching or listening, there will be a way to learn more about EZaccessMD.
Awesome. Thanks, CJ.
Thanks. Take care.